I want to share some information. This is extremely important during this time. It's Wednesday, April the 8th, 2020. We're in a pandemic throughout the world. And bear with me. Give me 5 minutes and I will explain some critical information. So, the College of Physicians and Surgeons of Ontario state that patients have the right to make health care decisions that accord with their own values, wishes, and preferences. And this includes decisions to pursue complementary alternative medicine, either as an adjunct to conventional medicine or instead of conventional medicine. It's important because I want to share some information. So, and I also want to share I have a letter from Health Force Ontario. It is actually dated September 27th, 2011. And in it, it states, the ministry has taken steps to support interprofessional collaboration among health colleges and regulated health professionals. You may be interested to know that Health Force Ontario, the province's health human resources strategy, has identified interprofessional care as an important factor in meeting its objective of ensuring that Ontarians have access to the right number and mix of qualified healthcare practitioners. So just so you know, the reason why I'm standing here doing this and having my certificate showing in the background is because it states, that I am a regulated healthcare practitioner. That's what I am, okay? And at this time when our healthcare practitioners, our nurses, our doctors, and other healthcare workers are being stressed to the max, we should be being used as homeopaths because homeopathic medicine has been around longer than pharmaceutical medicine, okay? Homeopathic medicine is actually been shown very, very effective in pandemics. And in fact, right now, Cuba is giving prophylactics to their elderly, the most vulnerable in their country. They have used prophylactics in other epidemics and pandemics throughout their country, okay? So right now, we're having an outbreak within nursing homes and the elderly. We should be taking advantage of homeopathic medicine as a prophylactic to those that want it and those that are vulnerable to be able to prevent, could potentially, okay, and or treat. So here's some statistics. I'm going to go backwards on this one. So during the diphtheria epidemic in 1862 to 64 in New York City, the mortality rate under allopathic treatment was 86.6%. Under homeopathic was 16.4%. During yellow fever in the United States in 1850, allopathic mortality rate was 15 to 85% and 6.43% under homeopathic treatment. Cholera, 1849, 1,662 cases of cholera were treated with homeopathic medicine. Mortality rate was 2.9% and 10% under conventional medicine. So, homeopathic medicine has been used effectively in large-scale epidemics as in typhoid, cholera, scarlet fever, and in influenza. I share that because we're going through the coronavirus right now. Maybe this is a wake-up call. Maybe it's time to get back to some medicine that has been around longer than pharmaceutical medicine. I'm actually going to send this video to our members of parliament in Ontario because that's where I'm regulated under. And I'm also going to send this to the mayor and councillors of Hamilton because they hold a special part for me. And as well, through history, Hamilton was actually the first homeopathic society, actually was started, and their newspaper was started in Hamilton, Ontario. I think Hamilton needs to get back to its natural roots, and I think Ontario needs to have a wake-up call and to implement all of its healthcare practitioners and get back to what the people of Ontario actually desire, is adding complementary or alternative medicine. I call it complementary. We can add. Complementary means to add on to. Alternative means to take instead of. To give people that choice And if homeopathic medicine is being utilized right now as a prophylactic, why aren't we using it? Why are we not using the skills of homeopaths right now in Ontario to take away some of the burden of our doctors and nurses? We can be utilized. We are regulated healthcare practitioners. Beyond that, there was a 12-year study done in Lucca, Tuscany, Italy, showing homeopathic medicine adding on to or being utilized in hospitals throughout Italy, or in Lucca, Tuscany. And I actually went and toured that hospital. And I actually met the doctors and watched how they worked. So I wanted to share with you, over 180 diseases were examined in Lucca, Tuscany over this study. And the most frequent one was respiratory issues. Now, right now, I'm sure most parents are terrified, absolutely terrified for their children to get this coronavirus. But let me just tell you, between the age of 0 and 6 years of age, presented with respiratory issues. And yes, it was not the coronavirus. I get that, okay? But I just want to show that they've done studies to show the effectiveness of respiratory issues in children, okay? No negative effects resulted from the use of homeopathic treatment in pediatric cases. And 0 patients presented worsening, and all of the patients, 74.1%, presented a complete remission, okay, in respiratory issues. Yes, I get it. I get that it's not the same as coronavirus, but what I'm trying to show you is the effectiveness. And what it came down to in the study was that overall, so the effectiveness of homeopathic, I could give you all the stats, but what I want to really show you is that patients treated with homeopathic reduced their overall pharmacological costs by 63.57%. Now, we as taxpayers pay for our healthcare system. We should be looking at that. If we can help out with homeopathic medicine, which the people of Ontario want, why aren't we utilizing it? So right now there's talk of a medication that is being used, or they've studied. Some doctors have talked about it, and even Dr. Oz did a talk on it the other day on one of the television news reporting about a medication that they use for malaria, and they use it on lupus patients, and none of them are showing any symptoms or getting coronavirus. So just so you know, there are homeopathic medicines for malaria that have been used for malaria. There are homeopathic medicines that could be used, that could be utilized, just like the pharmaceutical, as prevention, as being proactive, as a prophylactic. I can't make a claim. Nobody can make a claim, but they're showing that these worked. Homeopathic worked in the past on epidemics. Maybe we need to open our eyes, open our ears, and start. Maybe this is the time to change, to go back to what we used to be able to do, to give the people of Ontario the option, if they want, to go back to complementary medicine, either as an adjunct. It says it right in the colleges of physicians and surgeons that that's what they want. The Ministry of Health says, Ministry of Health and Long-Term Care says, that's their primary goal, is to interprofessional collaboration. Then we need to start making those steps to help the people of Ontario. If this epidemic of coronavirus is going to last for 2 years, that's what they're predicting, could last 2 to 3 years, then we need to make some changes. We need to be proactive. We need to utilize homeopathic medicine, in my opinion. And I always end my videos with, a happy heart is good medicine.